Welcome back to the Pelvic Health Summit. I'm your host, Hannah Matlock, and today we are here with two wonderful practitioners, Kristin Sapienza, a pelvic floor physical therapist based in New York City, and Ruthie Israeli, a clinical social worker specializing in women's health. Thank you guys for being here today and for talking about the importance between the mind and the body in healing pelvic pain.
Thank you for having us.
Yeah, thank you for having us.
So, do one of you want to touch upon the fact as to why it's so important to treat the mind and the body together?
Well, I do think a lot of pelvic pain is a factor in relationships, and that can cause a lot of strain. And that's why we find it so pertinent to work together on this and to kind of treat the person as a whole individual and not just like one part of it.
Mm-hmm. Yeah, and particularly when you're talking about pelvic pain, you're talking about pain that can either occur just sort of physically as well as stuff that's going on psychologically. And so when I'm usually assessing for what's going on, I'm usually doing a full sort of workup to see, I would maybe send them to Kristin or to a pelvic pain doctor to get a sense of, is this more pain related or is this something psychologically based?
And can you each talk a little bit about what conditions you treat and what patients are coming into your office with?
So in regards to pelvic floor physical therapy, I treat pelvic pain, pregnancy and postpartum care, as well as breast cancer rehabilitation.
So under the umbrella of pelvic pain comes vulvodynia, vaginismus, endo, and IC. So these are all conditions that patients come to you with in terms of pelvic pain.
Yes.
And similarly with you.
Yeah, I mean, I see the other end of it. I see women who are having, pelvic pain, but also just having a hard time with vaginal intercourse. And so I might see women by themselves who are solo and unpartnered, or women in relationships with their partner and just really suffering with the pain at the moment.
And do you find that treating these patients together helps their healing and the outcome of their healing?
Yes.
Yeah, it's definitely not a one-step process. Most of the work involves trying to figure out what exactly is going on. And so rarely do I find that it's just something psychological versus just something physical. Usually there's often, that goes hand in hand. There's a little bit of each happening at the same time. Specifically, if you've been in pain for so long and it hasn't been treated, there's going to be the aftermath of that in terms of the psychological effect, not just on the woman, but also on the couple as well.
Kristin, I know that you have your own experience with pelvic pain and endometriosis. So something that I'm so curious to hear is, how has your personal experience shaped the way that you treat your patients from the practitioner standpoint?
So my own experience made me really realize that it takes a village to help with pelvic pain, and we need someone like Ruthie, and we need pelvic pain doctors and acupuncturists and pelvic floor PTs to communicate and work together to help each individual suffering.
And Ruthie, as a therapist, I'm sure that you are very familiar with women who come in with pelvic pain, specifically vaginismus and vulvodynia and dyspareunia, and they're struggling to have sex with their partner. And often women feel like they're a failure as a woman and their bodies are failing them. So how do you come into the picture and really help them to overcome this?
Yeah, so one of the things is first helping them figure out what's going on with their body. It can be really hard when it feels like your body's failing you and you don't even know there's a term called vaginismus or vulvodynia. It doesn't even exist in your repertoire. So just giving language is really helpful as just a first step. The other thing is sort of understanding in what way they feel failed by their body, how long this has been going on, and if that's a message they've been giving themselves or that's a message they've been getting from their partner or within the context of the relationship a little bit. Usually what I'll do is sort of assess and then also send that individual to a pelvic pain doctor as well as a PT if that's necessary. And that often can help them feel a little bit better about their body because they can then feel like they have control over it. And the more control you can have over your body, the less you feel like a failure yourself.
And I think it's so wonderful that you have this connection where you send some of your patients to Kristin as a pelvic floor PT and vice versa. I also think that it's hard to find a therapist who has knowledge about what pelvic pain is and the various conditions that encompass that. Is there any kind of suggestions that you have for someone who may be looking for a therapist and wants to find someone that understands these conditions really well? I know I've seen therapists that don't understand them, and you can't work with them because they won't know how to help you.
Exactly. So I think the most important thing is to seek out either a sex therapist or a couples therapist, and then someone who specifically specializes in pelvic floor pain would be even better. There's something called STAR, STARR. And it's a collaboration of sex therapists, so you can just Google that and find sex therapists on their website.
Thank you. And then, Kristin, can you explain how pelvic floor physical therapy helps to treat the muscles and the pelvis that are causing a component of the pain? What do you physically do, and how is this physiologically helping the pain?
So I guess it all depends on which condition the patient is coming in for. But if a woman has vaginismus, let's say, and that's an involuntary spasm of the pelvic floor, they are unable to forego a gynecological exam. They can't use tampons. And when they've tried to have intercourse, it almost feels as if their partner is hitting a wall. So in regards to something like that, I have special techniques that some of my manual techniques for all the muscles in the pelvic floor aren't going to be as helpful, and that might be more relaxation training and the use of dilators.
Mm-hmm. Just something to sort of keep in mind is that by the time somebody gets to a pelvic floor physical therapist, they're already a few steps along in the process, because being able to be at a point where you're ready to have somebody physically touch you in some way, it takes a little bit of work. So sometimes part one is starting off just having that conversation about what would it be like to see, a physical therapist and start doing dilating work.
Mm-hmm. And another really important aspect of any kind of therapy that I really want to touch upon and want both of you to touch upon is the aspect of connecting with the practitioner. A lot of people don't connect with their practitioner because of many different reasons, but I think that in order to really be able to facilitate healing, you need to get along with the person you're seeing and be on the same page with them about your treatment and even your personalities. And I look forward to going to my pelvic floor physical therapist because we get along so well. I like to see her, and I think that even helps the treatment. It helps me get better. It's not something that I dread doing. And even with the therapist I'm seeing now, I look forward to seeing him because he's so helpful. So how can you guys kind of give advice for that important aspect of finding a practitioner that you work really well with and that you see eye to eye with in terms of sex therapy and pelvic floor physical therapy?
So from the physical therapy standpoint, I think it's really important to create an environment that feels safe and comfortable. And then if the patient is very comfortable, then they're willing to talk more about their issues and then open up about something that's really bothering them and what has triggered or a driver to their pelvic pain.
Mm-hmm. Yeah, and just to sort of add to that, I always tell the individuals who come in to see me, which is you really do need to trust yourself, right? It has to feel like there's a good connection. It's not always going to happen with me. I let them know and often check in. How did that go at the end of a session? Does that feel all right? And if someone's humming and hawing and they're not really sure, like, how do you say this wasn't really a good date, right? Yeah. But to sort of get them to sort of share a little bit more honestly about the fact that this might not be a good fit. Maybe they feel more comfortable with a male provider or an older provider. It has to really be someone that you feel that you really get along well with and that can support you.
And from the patient perspective, I've experienced my own problems with pelvic pain, and I think it's so helpful when you find the practitioner or the therapist that really does connect with you and that you connect with. and also acknowledging when you're not connecting with someone and knowing that there's so many other people out there and other therapists out there that may be a better fit for you.
Exactly. I think you can't be afraid to sort of shop around a little bit and see if this is a good fit for you or not, because it might not be that it's the pelvic floor physical therapist route that's the problem, or the sex therapist or couples therapist route that's the problem. It might be that that individual practitioner might not be the right fit for you. So you have to be your own advocate and really make sure that you're getting the right care that you deserve.
I totally agree, thank you. And to go backtrack a little bit and talk about women with sexual dysfunction problems, as you both treat a lot of these women, what are some suggestions that you can make for them if they need help navigating this difficult and complicated journey?
Yeah. Well, I think the first step is realizing that there's an issue, right? Because usually you're not the one to figure it out. Either it's your girlfriend or your boyfriend or someone's going to say, or your gynecologist, hey, you have a problem. So really taking a moment to take that deep breath and realize, hey, something's up. Maybe I should go take a look and figure out what's going on here a little bit. So that's what I would say is the first step. After that, yeah, it's sort of like a big deep sea in New York City, right? How do you find yourself a practitioner, and a practitioner that's going to be good and that's going to take care of you, or that's going to be willing to have a team approach? A team approach is super, super important, because if I don't know what's going on the other side and the other side doesn't know what's going on my side, and we have conflicting messages, then that individual has a big problem on their hand. So really advocating for themselves and most importantly, trying on practitioners the way you would with anything else. It's like a date. You've got to go out there and see, does this feel right? Does something telling you that this isn't a good fit? And if it's not, move on. Don't waste your time, don't waste your money.
Yeah, I think as a patient, you have to ask everything that's on your mind so you can just feel complete and complete those pieces of your puzzle, for sure.
Mm-hmm. And you also have to be ready. So sometimes it's not the practitioner and it's not the person, it's just the timing. So that individual, they're just not ready at that time in their life for whatever reason, and that's okay too.
That's great.
I have people come for like one session and I think, oh, I must have done a terrible job. But actually, 6 months later, they come back and say, oh, I wasn't really ready. That was a lot. It was great, but I realized I actually have something going on here. And that just took a little more time to process than they realized.
Interesting. So if we talk about vaginismus in specific, which is a very prevalent pelvic floor disorder, it can come on at various points throughout a woman's life. It can begin when they're young and they're just starting to have sex, or it can begin when they're going through menopause and there's hormonal changes that are causing them to have vaginismus and pain with sex, painful intercourse. So how is the treatment approach different, and what is the difference among the patients that you see in the age range?
I have to say I get a lot of younger patients who are suffering from this. A lot of women have grown up in certain cultures where sex is seen as taboo and almost shameful. So when they do attempt to have sex for the first time is when they start to realize that this is an issue for them, and it's almost as if their partner has hit a wall. Some may have been able to use tampons growing up, some may haven't, and they just thought that that was normal. Or some of them have a very hard time with a gynecological exam.
Yeah, and some actually just have a hard time even just talking about sex.
Yeah.
And being in touch with their body. One of the techniques I use is allowing women to just go in front of the mirror and see their vagina for the very first time. They've never laid eyes on it. And have no idea how it functions. It's sort of been separate from their body in so many ways for so long. That's sort of at the younger end of it. And then at the older end of it, you have women whose bodies are changing, and sometimes they feel like their bodies are failing them and that they don't have control over it. And they're going through hormone changes and lots of other different changes that go on at that time. And being able to balance that with their partner can be really difficult, because if they don't have a sense of what's going on with their own body, it's really hard for them to sort of explain that to the person that they're having sex with, and make that an enjoyable experience. So helping them really get control of what's happening for them, and psychoeducation, helping them read up on some things as well.
Yeah, it can happen to a lot of women after having a baby as well. So when women are trying to go back to having sex again with their partner and it doesn't feel right, or they feel that something's wrong on top of being extremely fatigued after caring for a baby, I think those women need help and education on kind of continuing with that and finding them the resources.
Can you explain a little bit more about women who come into you postpartum and are having pain with sex?
So in regards to postpartum, every delivery is different. Some women have certain degree, second, third degree tears or an episiotomy that creates scar tissue in the inside of the pelvic floor. And then those muscles cannot contract properly. So when they go back to try and having sex, I think the anxiety of having sex after a baby is something that a lot of women struggle with. But then when it doesn't feel right, it provokes that anxiety even more, and they clench in regards to that.
Yeah, and you have to remember that when the woman is going through that, often she has a partner who's, more than just a couple of inches away on the other side of the bed, who's experiencing the relational impact of that. Because if your vaginal walls are clenching, you're often not alone in that process, especially postpartum.
And so do you see a lot of couples come into your office together as couples postpartum?
Yeah, together, or often maybe the woman might start by herself, or actually her partner might start by him or herself, really worried about their partner, not sure what to do, and then the work will be to get them in together to actually start having that conversation. So often one's a little bit more ready than the other to have the conversation, and it might not be the person who's going through it. It might be the person who's having to experience all the stress around that.
And in the work that you do you find it helpful, more helpful, I guess I should say, when they come in together?
I find it a lot more helpful when they come in together. I mean, the way that I work is I tend to work transparently and sort of give a very clear picture of what's happening. And if you're living in a relationship with someone or in a system with a family, then those other people are being impacted directly. And so if they're not coming in together, then I get concerned, because I wouldn't want to do work with somebody having pain with vaginismus, and then she has a boyfriend or a husband, or especially postpartum, that's not involved in that conversation. It feels like a moot point to me, because that's only one half of the equation. That's putting all the blame on her in some ways.
And if the husband or the wife or anyone in the relationship doesn't want to go to therapy or is hesitant, how do you try and get them to come in together?
Yeah, so I mean, it's my job to really help them figure out what they want to do, not to sort of force someone to come into therapy who doesn't want to be there. So first is I would work with the individual who's there, which could be the person who's experiencing the pain, or the spouse or boyfriend or girlfriend of the person who's experiencing the pain. There's different kinds of pain, right? So that's the pain I'm talking about is the physical pain, and then there's the other person who's dealing maybe with the psychological pain, or both. So really the first part is figuring out what's going on, why they can't bring that person in, why that, what ideas their partner has about therapy or about vaginismus, for example, or the pelvic floor pain. They might have some, preconceived notions that might be accurate or inaccurate, and so I would want to sort of understand that first. But the most important thing really is to keep working with that individual and see if that can make a change within the couple on their own, if their partner really does not want to come in, and then see over time if something changes and the partner is willing to come in. Often the way that I do it is I do invite people for one session, and I say, I'm working with your wife or your girlfriend for once a week. We're doing this like week in, week out. Do you want to meet me? Do you want to meet the other person who's part of your sex life? You don't really have to stay in the session. I just invite you to come and see what's happening. Because I'm only with her for 45 minutes a week. You two are sleeping together every night. Sex might not be happening, but you're still in bed together. And if you're not and you're on the couch, well, then you really do want to come in, and you do really want to meet me. So I usually do it that way, and then if they feel like it's worthwhile, they'll come back another time, and if they really feel like it's worthwhile, they'll come in as a couple. And then at that point, I often offer an option to the primary person who came in. Do you want to see me as your sex and couples therapist, or do you want me to be your solo therapist just for the sex pain? And the reason why I do that is because I wouldn't want to not be available to that person individually the way I have been. So if it's been, 2 months, 3 months, 6 months, I offer that up. And then if the person says, yeah, you know what, that's a good idea. I want this to be our private space. I've already shared a lot. That might feel like too much to have him come into that space. I would refer them out to another sex and couples therapist and have him or her do that work. Or the other option might be is actually like, no, there's nothing I've said here that I haven't said in front of him. He knows everything. We review every session afterwards. Well, then why doesn't he want to come? Well, I don't know. And so at that point, I might say, all right, I apologize. They might say, he's willing to come in. Can you see us together? And then I would see them together at that point.
Interesting. Thank you. Yeah. And do either of you have something specific you want to share that motivates you to continue to do this wonderful work?
Well, I think since I've gone through it myself, it's completely motivating to help other women who are in the same boat. I think we have such a great group of practitioners, especially here in New York City, who are willing to help each other and just come together as a community to create change.
So one of the things that really motivates me and the day in and day out of doing this work is really helping women get to learn about their body, get to know, there's a whole half of our body that some of us aren't in touch with. So that's the first part. And then the second part is really watching them grow and get not just comfortable with their body, but getting comfortable with their sexual self, watching, pain go away over time. It's very rewarding. It's not like any other therapy where, it can be like long and sometimes you might not be able to see the results so quickly, but you do see the results. And when they do, it's, you change someone's life, because when someone comes in and they're having a problem having sex, they're at the end of their rope. You have women who feel like they just want to jump off a bridge at that point. I mean, how do you tell someone that you can't have sex? It's really hard. There's no forum to say that out loud in a sort of public setting with your friends, with your family. It becomes this big secret. And so allowing them to sort of, have life again, that's really the most rewarding part.
Yeah, I think pelvic pain can feel imprisoning. I mean, it affects sometimes sitting at work all day or exercising, or there's foods that flare you up, and you just feel that all these different aspects of your life are taken over by something that feels like it's bigger than you are.
Yeah, because if you have somebody who's not yet in a relationship and they're experiencing this problem, or have been in a relationship and the relationship ended because of that, then they're thinking, well, then what do I do? I'm living in New York City. There's all these apps that are available, but what do I tell him? What do I tell her? Mm-hmm. By the way, when it gets to sex, I have a problem. So being able to really help someone it's in some ways it's really unimprisoning them, like you said.
Mm-hmm.
So what do you tell your patients who come to you with that question?
Yeah.
Oh. I know that's like a whole session, or multiple dozens of sessions, but like, what would be one important takeaway for someone who is having painful sex and
needs to figure out how to share that? So one of the things that I do is figure out, it's really case by case, and I know that's a kind of like a therapist sort of answer, but it really is the truth, because what I like to do is figure out what is a problem for that individual. Mm-hmm. And once they can own it for themselves, understand for themselves what is really going on with them, then they can figure out some way of sharing some version of that can land for the next person who they're going to go out with. And so we role play it a little bit. And does it need to happen on the first date? Does it have to happen on the second? Is it only for people that you're in a relationship with? Some women, depending on how much touch is involved, they freeze up. But for some, it's just at the point of penetration, so maybe that can wait a little bit. So it really does depend on the woman and the social context as well.
And something else that relates closely to this that I think is important to touch upon is the component that healing takes time, and this work takes time. No one's coming into your office and leaving miraculously better. Mm-hmm. This is something really hard for people to understand and to wrap their head around. Everyone obviously wants to feel better as fast as humanly possible. So how do you instill in your patients that they're going to have to be patient?
I mean, I think that definitely comes up in the first visit. And you say to that patient, sometimes this took a very long time to develop, so it's going to take a very long time for it to go away.
And they want to know how many sessions right away, right? How many sessions do I need? What is this going to cost me? How quickly is this going to be done? And it really is different for everyone. You know, some women, when you get under there and you start talking to them, they have a history of trauma. Other women don't have a history of trauma, but they grew up in a household where sex was just taboo, or it wasn't taboo, it just never got spoken about. Everyone has a different story that they're coming with and has a different reaction to it.
Yeah, and I'll have a patient coming in for their physical needs, and then in the 6th visit, they'll tell me something psychological that happened to them, and that then spurs me to talk to Ruthie, but we didn't realize at the beginning that this was going to be a little bit longer than what it would have seemed.
Yeah, and it actually happens the other way around too, right? Couples come in for just couples therapy, we're having communication issues. Okay, well, what kind of communication issues are you having? And one of the things that you do if you're trained in sex therapy and in couples therapy is ask, well, how are things going in the bedroom? And you'll get the, will you say something? Do you want to say something? I'm not sure. And being able to sort of hear, well, actually, she's been having some real physical pain. What do you mean? Have you gone to a doctor? Yeah, but, you know, and you kind of get this push and pull. And then at that point, it's like, all right, if you haven't been to a doctor, then it's time to see one. Or to see, you know, a physical therapist or, you know, a pelvic pain doctor.
I think even women come in with certain conditions like low back pain or hip pain, and I'm not afraid to ask the questions like, hey, is sex painful? Yeah, sex is always painful. And they think that that is normal. That is not normal. So we have to find what are the drivers to why that is painful.
And that's the first question, which is sex painful? The question that a lot of these women aren't even thinking about is sex enjoyable? Are they getting something out of it? Because the first thing is like, okay, well, we want to eliminate the pain. We actually want the penis to fit into the vagina. Great, we can live our lives now. But then there's a whole secondary aspect, which is, can they start to enjoy it for themselves and with their partner?
So what is a treatment protocol for a woman with vaginismus?
So one of the main things that we use are I have all of my patients buy a set of dilators when they have the specific pelvic pain disorder. And the dilators have all these different sizes. And we start with the smallest size, and they bring it into the office. I show them how much lubricant that they need so that they can practice this at home. And we practice inserting it in what feels comfortable, and if they don't feel comfortable, we do some relaxation training with some deep breathing to make sure that they feel okay. Then we try again. And there's some days too where they're like, I can't do anymore. So then we stop and we'll do some things. We'll go over sitting posture, some things that may help them feel more relaxed throughout the day and through their activities of daily living.
And in terms of therapy, what does this look like?
So in terms of therapy, it's first of all just talking about what it would be like to put a dilator in, right? So to get to that point where she's ready to insert the dilator can take a while, or might be right away, depending on the individual. And then, you know, does she want to have the dilator done in privacy? Does she want her partner there holding her hand or not? What's necessary for her and figuring out the best course of treatment for that. Also, the other part of that is that while the dilating work is happening, the couple still needs to have a sexual menu. And a sexual menu is something that allows them to feel sexual with each other while not necessarily having vaginal intercourse and having penetration. In terms of creating a sexual menu, I would have the couple go home and each privately write things that they would want to be doing with each other in a physical way that doesn't include vaginal penetration for that period of time. And they might, it can be anything from hand holding to something a lot more physical. And they don't share it with each other, and they keep that separate, and they come back in, and then they each share what's on their wish list, so to speak. And you'd be surprised, he has like 102 items on his wish list, and she's got like 2, right? or vice versa. You'd be so surprised that her sexual appetite is different from his. And then they come back together, and then together we sort of review what each of those are and which one makes it into their joint menu. And so the menu might shift from week to week, from month to month. And so we start with a few things and we put that on the menu and give that as an option, because when Kristin is doing this dilating work, that can take, for some women it can go very quickly, for some other women it can go months, and in severe cases it can take even longer than that. And so we need to keep that couple together, not just emotionally, but sexually during that time, in a way that feels good and comfortable and fair for both of them.
That's fascinating. Thank you. I think it's really helpful that you guys have been able to collaborate and refer patients back and forth, and I hope that for all of the practitioners listening, in addition to the patients, they see how important it is to have a network and a care team of doctors and physical therapists and sex therapists who really understand fundamentally what pelvic floor dysfunction is and how it takes so many different approaches and people and experts to get to the root cause of the pain and heal the pain. Yeah. So thank you for the work you do, and thank you for being here.
Thank you for having us.
Yes, thank you.
Can you also share with everyone where you can be contacted? Do you want to go first?
I can be contacted through my website, femfirsthealth.com, femfirsthealth.com.
And you can reach me directly at my email at ruthieisraeli@gmail.com. That's Ruthie, ruthieisraeli@gmail.com.
Thank you so much. And for those of you that resonated with this video, please leave a comment below and share it with anyone else who you think may benefit. Thank you.